Well, two men are in a hospital with serious injuries after being hurt in a bull running event in central Mexico over the weekend. One was gored in the stomach. Another got a leg wound from a bullhorn. Officials say around 20 people were injured at the event. Most of the injured received treatment at the scene. A total of 6 were hospitalized. And scientists found vaccinations for shingles, pneumonia, and other diseases could potentially reduce the risk of developing Alzheimer's disease. The researchers from the University of Texas Health Science Center at Houston found that individuals who got the vaccines had as much as a 30% reduced risk of developing Alzheimer's. And a new study found symptoms from long COVID created more disability than heart disease or cancer. Researchers found patients who survived the coronavirus before there were vaccines were at higher risk for more than 80 health issues for up to 2 years after they got over their initial infections. Now, the study was published Monday in the journal Nature Medicine. Joining me now to talk more about this is Dr. Monica Gandhi, professor of medicine and associate chief of the Division of HIV, Infectious Diseases, and Global Medicine at UCSF. Doctor, thank you for being here. So what is a bit alarming, you could say, COVID, not the only viral outbreak that's caused long-term after effects. People who survived the 1918 influenza pandemic had a higher risk of developing Parkinson's disease, as you know, too. So what do you make of these long-term effects?
So, the long COVID literature has actually been sort of all over the place, unfortunately. And I think the best study that was just published, you just mentioned one in Nature Medicine. There was just one published last week in the CDC MMWR that really compared COVID to other illnesses, like you just said. Any severe illness can unfortunately lead to lingering symptoms. And that was probably the best study, the CDC MMWR study, that showed there's about a 16% rate of having persistent symptoms after any severe illness, whether it was COVID or not. And so what we're turning our attention to is what's called anti-inflammatories, looking at medications like metformin or colchicine or other medications that bring down inflammation, because that can persist after any severe illness. We knew about this in HIV for a while, and now we need to turn our attention to long COVID. So it's not necessarily specific to COVID, it's any severe viral or pathogen illness. And I think now the study that was launched called the Recovery Study by the NIH to look at a series of treatments, I think that's our best bet to try to help patients with lingering symptoms.
Understood. So scientists noted that 90% of patients in the study were men, while women account for more than half of long COVID patients. What limitations does this place on the findings, if any?
Right. So it was interesting because up to this point, most of the studies looked at the effects of long COVID and looked like it was more in women. And you do have to separate. This was a study based on kind of ICD-9 codes, ICD-10 codes, which are just codings of different conditions that occur after long COVID, but it didn't necessarily show causation. The problem with observational studies is you can have an event and then you can have something happen after, and you don't know if that event of COVID was causative. And this is the difference between sort of randomized studies and observational cohort studies, where you may not explain all the confounders. So we have to tease apart the effects of depression, anxiety. There's been a lot. It's been a really hard time coming off a pandemic. We have to tease out the effects of other medical conditions like cardiovascular health, inflammation, obesity, gaining weight during the pandemic. All of that makes this study a little harder to interpret. And I think the best studies that we're going to get are, again, in the recovery study, where we're going to randomize people to half taking a medication, half not, and see how they feel afterwards in terms of long symptoms.
Well, that makes a lot of sense. There's so much rolled into COVID and its effects and implications. So we've got about 30 seconds left, but I wanted to squeeze this question in. Scientists looking into potential treatments now. However, will the fact that we still don't know with certainty what causes long COVID, how will that interfere with the development of effective treatments in your view?
I agree. It's really complicated because Paxlovid, which is an antiviral, in a small study was closed at Stanford, didn't show to have any effect, but we are going to do a bigger study. The one thing that's looking okay right now is metformin. So everyone look into this. It's called COVID Out. And it was a study that showed metformin brings down that inflammation and may really provide relief for those who are suffering from lung symptoms.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.